by simply looking into your oral health and improving plaque control, improving the system of bacteria in your mouth and your oral microbiome, we can actually see great results in sexual performance and sexual satisfaction. Actually, the research is saying is that men are affected as much as women are affected with problems for conceiving. There are two main bacteria that we like checking when we see patients trying to conceive, and this imposes a big risk not only for the baby but also for the mother. So if you are a couple and you're trying to conceive, we really need to focus on. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. We're diving into the surprising science connecting your mouth with your sexual performance and fertility. You learn how these areas are intertwined in ways you never imagined. Imagine if brushing your teeth could do more than just protect your smile. What if it could also boost your fertility and enhance your sexual health? On this episode, we'll uncover the scientific connection between oral health, male sexual performance, and fertility. We'll explore the latest research explaining how oral inflammation can sabotage your reproductive health and empower you with practical tips to protect both your smile and your future. So stay to the end and you're going to be fascinated about what you're going to learn here today. So let's get started. As I've been diving into research on infertility, I've realized just how many different factors can make it difficult to conceive or grow a family. Age is a big one. Weight, past infections, hormonal changes, anatomical issues, and even lifestyle habits all play a big role. For men, there are things like overheating the reproductive area, like using a laptop on your lap can lower sperm counts. Sometimes temporarily, sometimes permanently. So be aware of that. We're seeing more people choosing to start families later in life, and that's something to consider. But what really stands out to me is how important it is to take a holistic approach. We can't just focus on hormones or anatomy. We need to look at the whole picture, including oral health. Research now shows that good oral health supports the production of nitric oxide, which directly affects blood flow and reproductive function, including sperm production. That's why I believe health professionals need to work together across specialties, and why I want to highlight how oral health connects to fertility. By understanding and addressing all these overlapping factors, people can have best chances of conceiving. The other important point I want to make is that even though most couples still try to conceive naturally, when that doesn't work and treatments like IVF are considered, it becomes even more clear that successful conception requires attention to both partner's health. So whether you're just starting your journey or exploring fertility treatments, remember that it's a team effort and both men and women need support and care along the way. Our journey begins in the mouth, home to trillions of bacteria forming a complex microbiome. When balanced, this ecosystem keeps your gums healthy and inflammation at bay. Unfortunately, poor oral health, immune health, stress, or the presence of gum disease, specifically periodontitis, can disrupt the balance. This leads to chronic inflammation extending beyond your mouth, affecting your whole body in ways you may not realize. Let's talk about what happens when oral health declines. So gum disease not only results in bad breath and painful gums, it can also trigger systemic inflammation, impacting various bodily functions. So what is gum disease and periodontal disease? I want you to understand this so everything else we talk about makes more sense to you from here on. Periodontal disease is also known as gum disease, and despite the fact that it's very common, in fact, 1/3 of the adult population has a form of periodontal disease. So it has some form of disease in the mouth to an extent, to the gums, in fact, to an extent. It is a serious infections of the gums and of the supporting tissues around the teeth. I'm just going to show you my model here because I brought this specially to show you what happens with gum disease. So this is what we see as normal gums. And then if I flip this, I want you to see what's happening inside. This is when we see the advancement of periodontal disease. We see that bacteria starts getting trapped inside the gum, but as we know, the gums are actually a protection for the bone. So the bacteria go inside the gums, and if we leave the inflammation there, an infection there long enough, the bone is going to start being affected. And from there, it affects the bone. We know that all this is connected to our scalp, to our body, and the blood flow that goes around here, it actually flows to your stomach, to your uterus, everywhere in your body, to your brain. And this is a very important thing to understand. So I just want to make this point really clear for you before we progress in this conversation. It usually starts with your gums becoming red, swollen, and bleeding easily. These left untreated can get worse over time. Well, stop right there. What I want you to understand is that nowadays we have ways of checking which microbiome is inside your mouth. And what we see a lot of the time is that we don't wait any longer for oral signs to happen. We don't wait for bleeding gums or discomfort on the gums. Actually, a lot of the time, this disease is quite silent, and we can only pick that up at our clinic because we actually test the microbiome of our patients. So by looking at the microbiome, we can predict certain things and we can treat them really early. Now, why this is so important when it comes to fertility, male dysfunction, and pregnancy? Well, let's focus on erectile dysfunction first, also known as ED. ED is defined as a consistent inability to achieve or maintain erection. It serves as an important warning sign of broader health issues, particularly concerning blood vessels and inflammation. Here is the kicker for you. Periodontal disease fuels erectile dysfunction. Let me help you understand this better. There are two main connections that we see here. One is infection, especially in the presence of Propheromonas gingivalis, also known as PG, which is a bacteria that interferes with the production of arginine. Arginine affects nitric oxide production, which nowadays we know that it affects blood flow. In order to have a healthy erection, we need a healthy blood flow. Otherwise, we won't see that happening. The second reason is that inflammation caused by the gum disease and the presence of this bacteria also release chemicals in the bloodstream, which can lead to damage in the blood vessels. This process, known as endothelial dysfunction, is crucial in developing atherosclerosis, which is when plaque builds up in the arteries. Healthy blood flow is essential for achieving and maintaining erection, and these vascular changes may lead directly to ED. Studies show that men suffering from periodontitis are significantly more likely to experience ED. Now, I have exciting news for you. Treating gum disease can improve both vascular health and erectile dysfunction. So remember, taking care of your gums isn't just about aesthetics. It's an integral part of protecting your overall health, heart, and sexual well-being. So if you are a couple and you're trying to conceive, we really need to focus on both sides of the equation. What actually the research is saying nowadays is that men are affected as much as women are affected with problems for conceiving. So when we're looking at couples, we really want to help both sides to achieve better health. If we treat the male or one partner and we don't treat the other, but they interact, that interaction will actually recontaminate the partner. Obviously, we need to take into account the immune response. And sometimes I see couples and both couples present with the same oral microbiome, with the same bacteria, and we treat them both. Sometimes I see one person with certain bacteria and the other person doesn't have that bacteria. That will come down to a lot of things, but one of them is immune response. But ultimately, if we want to have a great result and not keep recontaminating, because every time we see our patients every 3 or 6 months, depending on the case, we're going to retest the microbiome. And sometimes people are doing everything they can do, but if they keep the same source of contamination, we are actually just perpetuating the problem. So ideally, we should see both partners in order to have an effective treatment. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. Okay, so how about sperm quality? A detailed systematic review looked at the wide range of studies regarding the relationship between periodontal disease and sperm quality in adult men. The review found significant associations between periodontal disease and issues like reduced sperm motility. In other words, the sperm becomes more sluggish, with an abnormal shape and with increased sperm DNA fragmentation. The overarching conclusion is clear. Chronic oral inflammation from periodontal disease could really affect male reproductive health. At this point, I want to shift gears a little bit and focus on the oral microbiome and their connection to reproductive health. The interplay between these microbiomes can impact your reproductive system, especially when these microbiomes become dysbiotic, which is an imbalance in the natural community of good bacteria and bad bacteria. And this is known to trigger inflammation, metabolic disturbance, and hormonal shifts, all of which can negatively affect both sexual function and fertility. There are two main bacteria that we like checking when we see patients trying to conceive. Just before I break this down a bit more, I have to say that these bacteria have been related to at least 50 different types of diseases. But for the purpose of this episode, I'm focusing on reproductive health and pregnancy. The two main bacteria are Fusobacterium nucleatum, which is we're going to say FN here, and Propheromonas gingivalis, the PG that we've just spoken about. What we know nowadays is that the presence of FN will increase infertility by 3-fold. And the presence of this bacteria creates waste that is toxic to the fetus and may cause stillbirth. What we see more and more in the most common updated research is that when we have this bacteria with or without signs of periodontal health involvement, we are seeing more premature births, more pre-eclampsia, and sadly, stillbirths. I hope there are doctors watching this episode with us today, because it is really, really important that we work together in order to help our patients. We want to decrease the expenses for our patients, the emotional and the physical stress that couples and people go through in order to conceive. I really cannot emphasize enough the importance of a holistic, integrative approach in order to help our patients in a more assertive way. But what else do we need to know about Propheromonas gingivalis? PG is closely related to pre-eclampsia, which is when pregnancy is affected by high blood pressure. And sometimes we don't have a history of high blood pressure pre-pregnancy, but we see a high blood pressure during pregnancy, and this imposes a big risk not only for the baby but also for the mother. Another important part of this puzzle is when your immune system is activated to fight certain bacteria. It starts releasing special proteins called cytokines, which are meant to fight infections, but they can actually end up causing trouble elsewhere in the body, including your reproductive system. These cytokines can travel from your mouth into the bloodstream, spreading inflammation and disturbing the delicate hormone balance needed for fertility. In women, this can make it harder for the body to ovulate or for an embryo to implant, and it messes up with hormone levels. So what is the scientific evidence? How oral health influences your whole body? It's essential to recognize that periodontal disease doesn't confine its effects to the mouth alone. It can lead to widespread inflammation that increases your risk of heart disease, diabetes, reproductive complications, Alzheimer's, and many other diseases. Moreover, research indicates a strong correlation between oral health and sexual function. Men with poor oral health often report less sexual satisfaction. The good news: restoring your oral health can lead to improvement in both general well-being and sexual satisfaction. Now that we understand the stakes, let's discuss some practical steps you can take to safeguard your oral health and, in turn, your overall wellness. Brush and floss daily to prevent gum disease. I would say go beyond. Get a water flosser, start water flossing, do some coconut oil pulling, go back to our previous episodes and watch other episodes so you can understand more how you can keep yourself on top of your oral health. Schedule regular dental checkups and visits. This is very, very important. Sometimes, as I mentioned before, we have no symptoms of periodontal disease. We have no signs of gum disease, but when we collect the microbiome of our patients, we see very pathogenic bacteria and we see big loads of them in the mouth. If you notice any symptoms like bleeding gums, persistent bad breath, don't wait for that. But if you're already feeling that, seek help. Start implementing good habits at home, because you're going to feel a big difference already, but seek help. Find someone that you trust that can actually help you deal with those problems. So if you're worried about what we're talking about here, if you're worried about your gums, oral infection, oral inflammation, and how that's affecting your body, we can actually help you achieve great results and minimize the number of these pathogenic bacteria and the consequences of this in your whole body. What we do work with lasers, ozone therapy, and especially finding the root cause of the problem, because once we find the root cause, we can actually tackle that in a very assertive way. So what happens when we collect the patient's microbiome and we see in patients that are trying to conceive, and when we look at overall health, because that's the approach that we like having. When I see those pathogenic bacteria, what we do in our practice, we look at a microscope, we get the sample, I bring my patient with me and we look together. So we're actually exploring what's happening in that sample. In a lot of cases, we need to send that sample and to collect a bigger sample to send overseas, and we do specific DNA testing to understand specifically which bacteria we have. In the dental chair, what we do, apart from thoroughly cleaning and removing that plaque and educating our patients on what can we do in order to improve health, there are a lot of things that I discuss with my patient, and it is a case-by-case approach. A lot of the times we talk about probiotics, we talk about gut health and how we can seek help to improve the gut health, because it's all interconnected. We address the gum inflammation, and we decrease the number of pathogenic bacteria with ozone therapy, laser therapy, regular checks, and we revisit that sample in about 3 to 6 months. It's a case-by-case approach. By doing so, we're making sure that we're minimizing the body's response to infection and to inflammation. And as we've spoken before, we know the devastating effects that those have in the body. So we have a comprehensive approach. I like talking to my patients about every step of the way and what can be done in order to reestablish good health. And that's crucial when we're treating disease, when we wanting to conceive, when we want to focus on longevity, but longevity with quality. We want to age with quality nowadays. We have all the resources that are so overlooked, and sometimes a simple thing like improving oral hygiene has a massive effect in health and life quality. And finally, consider your oral health as part of your holistic wellness. It is an integrative approach that we want to get in order to facilitate, in this case, fertility, pregnancy, and sexual performance. So to wrap up, remember that your mouth serves as a gateway to your body and your future. The science is clear. Maintaining good oral health isn't just about avoiding cavities. It's a powerful way to protect your sexual performance and fertility and your overall well-being. We won't see a healthy pregnancy if we don't have a healthy mouth. Let's keep this conversation going. Share your thoughts, experiences, and questions in the comments below. And don't forget to like, subscribe, share this information, and let's help people make more educated decisions about their health. Thank you for joining me today, and until the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.